Pregnancy triggers a roller coaster of emotions and uncertainty. Checking on a developing fetus early on can provide some comfort. And now there may be something new for doctors to examine.
It's tonight's special segment, and Health Beat reporter Sylvia Perez is here to tell us about it. Sylvia?
Ron and Kathy, prenatal screenings can help sort out which women may need to have more invasive testing to look for genetic conditions. But invasive tests carry a small risk, so many people might want to avoid them. Still, current non-invasive screens aren't perfect and may alarm couples needlessly or falsely reassure them. In the quest to make these techniques better, looking at the tiny ear on a developing fetus could make a difference.
Life is but a dream.
For the Jemsek family, life is dreamy. They are enjoying time with their son Sawyer and now preparing for the birth of another child. But this time around, there's a few more options to consider. Meredith Jemsek is now 35, and that puts her at higher risk for delivering a baby with genetic abnormalities. They wanted to know as soon as possible if the baby was okay. So at about 12 weeks, the Jemseks opted for the standard prenatal screenings that include blood tests and ultrasounds to measure the back of the fetus's neck. Thickening in this area has a strong association with Down syndrome.
It didn't hurt me, it doesn't hurt the baby, it's just to gather information and make informed decisions.
But the Jemsek screen actually involved more than what is usual. Something not normally measured was.
We looked at the angle of the ear, and that measures 7.48.
Dr. Norman Ginsberg with Reproductive Genetics Institute did a detailed exam of the angle of the fetus's ear.
We know that Down syndrome children have low-set ears, and they're posteriorly rotated, which means that they're turned back.
Doctors have known for years that the position and location of the ear is often abnormal in fetuses with Down syndrome and other chromosomal abnormalities. But the ear was not always easy to see. Dr. Ginsberg says early research is showing advanced 3D technology now has the potential to make this ear screening more accurate.
I think it's actually going to be the #1 most powerful marker compared to all the other things that we look at.
In a pilot study online in the journal Prenatal Diagnosis, 348 pregnant women had a 3D rendering of the fetal ear. They also had more definitive chromosome tests. It was discovered 23 women had a fetus with a chromosomal abnormality through invasive testing, and they were also flagged with the abnormal ear angle. But it wasn't foolproof. Of all those screened, 1 to 3% with an abnormal ear angle had no chromosomal problems. Rush OBGYN Jock Abramowitz says even with 3D imaging, getting a clear picture of the ear isn't always easy.
At the moment, I certainly cannot say that it is the best and it will replace anything else. It's probably an additional one and may help, but at the moment, it's certainly only in the research phase.
For the Jemseks, the ear screening offered an extra level of comfort early in the pregnancy, but they still decided to go forward with more traditional, definitive tests. The Jemseks learned everything is fine.
Are you giving kisses to the baby? Oh, that's very nice.
Prenatal testing isn't for everyone, of course, and some couples might just choose not to have it at all. Doctors can use other physical markers to help identify an increased risk of chromosome problems. Dr. Ginsberg agrees more research is needed to confirm his findings. But an interesting side note, Dr. Ginsberg is also known in the United States as the father of CVS. That, of course, one of the well-established and definitive invasive prenatal testing. Now, the good news is for women who do want to have prenatal testing, there's a lot of research in the works doing more testing that is not invasive so they can feel a little more comfortable with it.
Thanks.
Thanks, Sylvia.